Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Signs and symptoms of rheumatoid arthritis. It is very important for you to know these signs and symptoms so that you can recognize this disease as rheumatoid arthritis and you can appreciate when it is exaggerated in the course of time. First manifestation will be in your joints. Your joints will be affected. The affection will be symmetrical. Symmetrical means you get both sides of the joints. If you get pain in left hand, you also get pain in right hand. If you get the pain in the joints of right hand or leg or right side of the body, you will get on left side of the body as well. Always the affected joints are on both sides and are symmetrical. Not only one joint is affected, multiple joints are affected. Initially small joints are affected, but in the later stage where the disease progresses, multiple joints are affected. Bigger joints also affected in the advanced stages. You will have redness in the joints, swelling in the joints, pain in the joints. You have stiffness in the joints. The characteristic feature is you have nodules. Nodule means small raised portions like foreign bodies are deposited in your joints. You can see this in all the joints or almost all the joints. These are known as nodules. These are a characteristic symptom of rheumatoid arthritis. The first joints that are going to be affected are the finger joints. You will get this initially in the fingers. Coming to the hand joints, the joints of the hand. First, these are affected in your metacarpophalangeal joints. Metacarpophalangeal joints means normally we call them as knuckles. The second joints that are affected are proximal interphalangeal joints. Proximal interphalangeal joints are these joints that get affected in the second place. Then the joint affected is the wrist. Wrist is one of the commonly affected joint because of rheumatoid arthritis. It is the third joint that is going to be affected. And there is a specific type of deformities you can see in this disease. First one is swan neck deformity. Swan neck deformity is where the first interphalangeal joint or distal interphalangeal joint is flexed like this, and the proximal interphalangeal joint is extended. The joint will be like this. The next deformity we see in the fingers are boutonniere deformity, where it is exactly opposite, where the distal interphalangeal joint is extended and the proximal interphalangeal joint is flexed like this. So you can see this in the picture. There will be ulnar deviation of the thumb. Thumb will be deviated to the ulnar side. There will be radial deviation of metacarpophalangeal joints. These joints will be deviated to the radial side of the hand or outside of the hand like this. The next one is carpal tunnel syndrome, where it will affect the wrist because of the affection in the wrist, because of the nerves that are pressed at the wrist. You have the pain in the hand, numbness in the hand, tenderness in the hand, lot of sensations or tingling and numbness in the hand you can see because of this carpal tunnel syndrome. And coming to the feet, you can see the joints of the feet are also affected. They can be a cloto deformity, or they can be a hammer toe deformity, or they can be subluxation of metatarsals where the toes of the feet goes under the previous bone. So it will be like bone under the bone. You can see that deformity in advanced cases as well. The other joints that are going to be affected are the shoulder joints, the knee joints, or the hip joints, or the ankle joints, and also especially the cervical joints where C1 and C2 joints can be affected because of this disease in the later stages. Not only the joints, there are other systemic affections where it affects whole of your body. Like you can have fever, you can have body pains, you can have malaise. Malaise means you will feel like you have fever but you will not have fever. You will have total body pains. There can be severe weight loss, they can be sweating at night, they can be sleep disturbances as well because of this disease. These are all the common systemic problems you have with this disease. And coming to the affections of other parts other than the joints, there are a lot of parts that can be affected. Coming to the skin symptoms, they can be nodule deposition, especially on the elbows, on the wrist, on the hands, on the toes. Lot of places you can see the nodules. There can be purplish discoloration. There can be micro bleeding on the skin, and also there can be ulceration of the skin. There can be ulcers formed on the skin at various places. And coming to the affections of the eye, there can be redness of eyes, swelling of the eyes, there can be edema of the eyes, and also there can be dried eyes. The eyes can get dried. It can also affect liver. These inflammatory mediators can affect liver. When it affects liver, what happens is your C-reactive protein is raised. You will have severe anemia, lot of indigestion problems, and also pain in the liver you can see sometimes. One of the major organ it affects in the advanced cases is your heart. There can be lot of heart symptoms like palpitations, and also severe symptoms like there can be plaque formation, there can be deposition of cholesterol in your heart. You can have heart attacks, you can have damage to the myocarditis, means heart muscle can get damaged because of this disease. Pericarditis means there will be layers around the heart that will protect your heart. Even these layers get inflamed due to this disease. Heart is one of the major organs that get affected because of this disease in advanced cases. Coming to the gastrointestinal system, your digestive system, normally you have dry mouth. There are a lot of neurological symptoms you can see in this disease. When the nerves are affected or brain and spinal cord is affected, you will see a lot of depression, lot of anxiety, and also lot of weakness due to anemia. And coming to the bones, it affects your bones. The calcium from your bones is resorbed. It affects your bones. It weakens your bones because of osteoporosis, where the minerals deposited in your bone comes out. Your bones will become very fragile and tender and weak. Coming to the muscle, you will have weakness of muscle, or loss of muscle protein. There can be soreness of the muscle. There can be tenderness of the muscle. Muscles become painful as well. It affects your bone marrow as well. Bone marrow is the main organ that produces your RBC or red blood corpuscles. Because of this, you land into anemia. Your blood values of hemoglobin comes down because of this. After heart, one of the major organs that is going to be affected is your lungs. It damages your lungs. There will be a lot of pleural effusion. Pleural effusion means collection of water or fluid in your lungs. So this is called pleural effusion. There can be scarring of the lungs. There will be a lot of damage caused to the lungs. There will be a lot of inflammation caused to the lungs. Because of this damage, lung tissue is replaced by scar tissue. There can be plenty of scars on your lungs. This can lead to dyspnea. Dyspnea means breathlessness. You feel short of breath, or you feel shortness of breath, and also a lot of complications and other symptoms related to the lungs can be seen in this disease, because heart and lungs are the major organs affected by this disease, that is rheumatoid arthritis. All these signs and symptoms is very important for you to remember and know if your loved ones or you are suffering from rheumatoid arthritis.
Fidicus Homeopathy